TV, and today we're going to talk about an upcoming sports-based conference. It's to prevent catastrophic injury among secondary school athletes, and I think this is a really good thing. So if you've got kids playing high school sports, or maybe if your children are in private schools, then you want to tune in. And joining us today is Berch. She is with Mississippi Athletic Trainers Association as the president, and she is the president this year. And Rebecca Stearns, she's with the Korey Stringer Institute, which is helping put this on out of Connecticut. So welcome, ladies.
Hi. Hi.
So, Kara, I'm going to start with you because, this is a good thing that we're talking about it, but maybe Mississippi doesn't rank the best when it comes to our efforts to prevent these kinds of injuries. So, from your perspective as the president for the Mississippi Athletic Trainers Association, tell us kind of how you feel, how y'all see this.
Well, one of the things that we want to do is keep our athletes safe playing sports. Throughout the state, some schools have the luxury of employing or receiving services of an athletic trainer that are out and about, just steadily watching the game, talking with athletes, making sure that they're making wise, healthy decisions, working with coaches and helping guide them on what they can do to keep athletes, let's say, well hydrated, good nutrition, good exercise programs, good time for breaks when we're talking about heat climates, how athletes should hit properly to prevent C-spine injuries, what to look for, making sure all athletes have physical exams and look for those heart conditions that normally can go undetected. And sometimes they still do, but there are means and doctors out there that can detect most of the common things. So importantly, we want to make sure those things happen. Unfortunately, Mississippi falls 47th in the nation of being prepared for these things. I believe we work with the Mississippi High School Activities Association as part of the Sports Medicine Advisory Committee, and we have a great deal of these things in place. We just don't do the best job of promoting these rules and policies, and we want to work towards making those more transparent so everybody can follow the best guidance to keep athletes safe. The private school and recreational sports really hasn't followed that much suit, and we want to encourage them to join a board and create rules and regulations, policies that do keep athletes from experience and families from experiencing catastrophic preventable conditions.
I had mentioned, Kara, I said high school students, which they would fall under the jurisdiction of the Mississippi Athletic Association. So you're talking about recreational, so you're talking more of like your community-based sports or your travel ball or those type of recreations that maybe not fall under the same sanctions that our high schools would. Is that correct?
That is correct. We, a few years ago, established a concussion law and for coaches with secondary school athletes that see signs of concussion to pull those athletes out. One thing we try to do is add a little bit of training for recreational sports. Unfortunately, that didn't happen, but we really would like to see recreational sports go through some training of recognizing concussions because that can be a deadly situation. But, these are just little pebbles of things that we need to see happen and grow, and by bringing stakeholders together to talk about the issues, maybe one day we can see those changes happen.
So, Rebecca, you're with the Korey Stringer Institute out of Connecticut. I bet y'all are colder than we are up there. Although we've been pretty cold this week, though, Rebecca, so I don't know. We may can go toe-to-toe for you. But how do you guys fit into all of this down here in Mississippi?
Yes. So the Korey Stringer Institute was actually founded in 2010. As part of our mission, we aim to not only enhance performance, but also safety for the athlete, warfighter, and laborer. And so we really do focus on the top causes of catastrophic injury and those injuries that can be potentially life-threatening. And so one of the programs that we have, and we started back in 2018, was this Team Up for Sport Safety initiative, and we call it TUFS. And it is sponsored through the National Athletic Trainers Association as well as the NFL. And that sponsorship has allowed us to go state to state to collaborate and gather stakeholders responsible for either the execution and creation of policy that governs high school sport, or the stakeholder groups that are kind of like the end user or those that are impacted by this. Because with Tufts, the real goal of this program is to ultimately propel the adoption of policies that are proven to reduce sport-related deaths in high school forward. And we want to see that, sooner rather than later. The idea is we know that these catastrophic injuries happen, and they will continue to occur until we can put some of these safety guidelines in place that we have shown to be really effective at reducing catastrophic injuries. So those 4 topic areas that I alluded to, the 4 top causes of sudden death that make up 90% of the cases that we see are cardiac arrest, head injuries, exertional heat stroke, and something called exertional sickling. Just those 4 conditions alone make up 90% of the high school sport-related deaths. So we really do try to focus in on those because we feel it's the most effective use of our time. And we have some policies that we pull from best practice statements, like the NATA's Preventing Sudden Death in Sport statement, that help to guide those efforts. And so we really try to gather the stakeholders within each state, pull them together, and try to support them as best we can to identify paths forward for some of these policies that are life-saving.
Kara, this is happening January the 22nd there at the MHSAA's main office in Clinton. Who all will be coming together? I mean, is there room for, concerned coaches or anybody else, or is this a very sort of selected group that you guys already have to come and sort of hear this information?
We've reached out to a variety of stakeholders, from legislators, superintendents, principals, coaches. Some people are available. Some, with us being a legislative session, they have some obligations. We've got a lot of representation from different parts of the state, doctors included, athletic trainers included, that will be coming in, being a voice for the state. Miss Rebecca will kind of kept us with a small group, in the sense of 30 to 40 people in a room, so we can have productive conversation. We definitely want to hear from concerned coaches.
I couldn't see anybody, coaches, parents, all of that, or even stakeholders being against, Rebecca, being against any of these policies that would keep kids safer. Is it more of just not knowing the data or knowing how to turn it into a quality policy, or are there other roadblocks that states have come up against from keeping this type of recommendations from moving throughout the system?
Yeah, that's a great question. And so I think, we've been doing this work since 2018. And so the good news from the years that we've seen now from progress from some of these meetings is that there's a lot of upward mobility, and we're seeing a lot of positive progress. So I do think a lot of the solution simply comes from being able to really efficiently deliver some of this information, making it consumable and really easily applicable and adoptable for these stakeholder groups. So that's really what we're trying to do, is just make it easier, because clearly, there's a lot of responsibilities that these stakeholders and organizations have outside of just focusing on catastrophic injury in sport. And so we hope that as the content area experts bringing that information, resources, tools, and making it as easy as possible will help facilitate that adoption. And that's really kind of what we've seen. And of course, there's going to be natural barriers to some of the items, but Mississippi is going to be the 38th state that we've visited. And so the great news about that is that we've seen it done 37 other different ways. And a lot of those successes are things that we think can help Mississippi.
Well, I think anytime we can put in just at least recommendations or policies that's going to help keep our kids safe, particularly as we have summers that were hot as last summer, or you have winters as cold as this winter, or whatever it may be, it's definitely a good thing. Can you ladies hang on? Because, Kara, I want to ask you something about what parents can do to be part of the solution as they, choose to feed or hydrate or whatever their children. Can you guys hold on?
Yeah.
All right.
Yeah.
We got more with the ladies coming up next radio station. We're continuing our conversation with some ladies talking about an upcoming sports-based conference. They're hoping to help prevent injury among secondary school athletes here in Mississippi, and I think this is definitely a good thing. And we've got the president of the Mississippi Athletic Trainers Association, Ms. Kira, as well as the Korey Stringer Institute out of Connecticut, Rebecca. That's a mouthful, but it's important to know who you guys are sort of representing. And Kira, sometimes there is this idea that there is a level of responsibility that is assumed when playing sports, particularly contact sports or anything that could lead to a concussion. And I think while that's true, let's address also why it's important that when we know better, we can do better to help sort of prevent or curb any of these occurrences with children, particularly under the age of 18.
Yes, there are a variety of things that we can do to kind of curb any of these catastrophic injuries from happening. It can solely come from education and making those right decisions. Also, by having those adults in place that can supervise, monitor, prepare our athletes for what they can prevent. There are so many techniques that can be taught to athletes to avoid making something bad. Sure, we can sprain an ankle. Sure, there can be a shoulder issue. But what we don't need is to have headlines of a death that has happened and it be something that could be preventable. So that's the important thing. And we do need to look at our parents being advocates and working with the school districts, working with school associations to try to establish those rules by saying these are concerns, what is in place, and how is your staff prepared to handle those things to prevent my child or a child on the team from being a statistic?
Talk about the AED requirements now. And this may be a question for Rebecca or Kira, whichever one. Explain that to me in terms of requirement. Is it required for the state for one to be in certain places and maybe we haven't made it there yet due to just funds or availability or whatever it may be? Or is it more loosely translated as an AED requirement?
In the state of Mississippi, there is no mandated requirement that an AED is present at the schools. However, it's strongly, strongly recommended. We have had athletes over the years die because an AED was not present. We do know that is the key element to any cardiac arrest is that quick activation of the AED. Having it within a 2-minute walk is the recommended thing. Now, I will say that last year in legislation, there was approval for funding. It is application-based to the Department of Health for schools to obtain an AED. The problem of mandating it for all schools is still it's a very pricey device. You're talking about a device that's $900 to upper $1,000 to get one. So that can really strap a small school on deciding what to invest their monies in the classroom or this one device when they can call 911 and they come. But I think that as it becomes more affordable, as those grants are becoming more available, schools do need to make it a priority to at least have one on their campus.
Yeah, it would help save lives, but you can understand the roadblocks to that. And I think, again, just a little education. You never know when you may have a PTO group or a mom or parents or caregivers group that may get together and figure out a way to make that available once they're given the information to do that. It may not always have to necessarily go the policy route. But speaking of like the parents and maybe the coaches, I'm looking back or thinking about this recreational sports. Again, that's not necessarily connected to high school. That's going to be your tournament balls. That's going to be your rec leagues, those type of things. There's a lot that parents can do just to be aware or be CPR trained or certified. Like I feel like sometimes we can help absorb some of this without it having to always be, the mandated sort of route. So for parents listening, what's some of the information that you wish they all, just took to heart if they've got their own athletes out there?
I think you've nailed one very important one. Go and get training. Get CPR certified. Go take first aid courses. we could try to rely on somebody else to do it, but if a parent wants to do everything, because it's like you said earlier, it's inevitable. Injuries are going to happen. That sprained ankle, that they could fall out and go into a heat exhaustion. Knowing what to do quickly, knowing what to do, not pulling out your phone and Googling what to do, knowing what to do immediately is so important. So for them to go and do that training would be absolutely the best thing they can do for their child and for those players on the team. And those courses are available all over the state of Mississippi.
And I think that's something we can be proactive with. I mean, if your student athlete is playing 3 and 4 games in a row, 2 and 3 days at a time, how the heat and all that can be. I mean, it would just be a little safety net, couple hours for a course or a class. You just have that little bit of protection and not necessarily waiting on a mandate to come down or the coaches to always have to do it or that way. I think if you've got student athletes, you can be proactive in that way, especially if it's something that weighs on your heart. The other part, though, too, it feels like more and more information is coming out on how to protect our athletes throughout the summer. And I know I hear it all the time. Back in my day, we didn't yada, yada this, yada, yada that. Well, we're not back in your day, and it feels like it's hotter outside, okay? And so when we know better, we do better. So something as simple as hydration and fuel, where can parents go to get really good recommendations as we do start to move back into spring baseball? We're going to start back up summer football. It will be here before we know it, even though it's cold, and better know how to encourage their athlete to better take care of themselves.
So I think Rebecca's great at answering this question.
So I would say that probably some of the best information you can get, because there is a lot of recommendations out there for hydration, but it really is a individualized factor, and because it can depend on the time of year, the athlete, the size of the athlete, the sport, fitness, so many different things. And so there are some great resources that are openly accessible, and I would always recommend starting off with documents that are published by leading sports medicine organizations. So, say, the American College of Sports Medicine or the National Athletic Trainers Association. They have published statements that provide best practices and guidance in terms of fluid needs and fluid replacement strategies for athletes. So I would always recommend kind of starting there, as those are experts in the field that have published a document that have been reviewed and endorsed by these medical organizations.
It's all good information, and I know you guys have a big day coming up on the 22nd. My math brain tells me I think that's Monday or Tuesday of next week. If anybody's interested in just keeping up with what comes out of that or what's moving forward, is there a way for people to do that?
So I think that the Korey Stringer Institute always has, and if people are interested in kind of the specifics, we always maintain a live repository of the current status for health and safety policies for athletes on our website. So anyone can go and click on their state and see kind of what we're looking for and advocating for in the policies in their state. So that's updated regularly. Anyone can go on and see that. And so you can see for yourself kind of the progress that states have made and looking ahead how the change is adopted. So that's one of the easiest ways, I would say, to kind of just keep track of everything and watch everything as it is propelled forward.
Kara, if we've got parents, caregivers, coaches, all the above that just, is intrigued and want more information, is there anything that the Mississippi Athletic Trainers Association can provide for them or direct them to?
Absolutely. We have our website, MSATA, Mississippi Athletic Trainers Association.net. There are some resources there that can be used. The MHSAA has on their website some documentation of things that they can look out for and they can do. I agree with the sports medicine-based documents out there. They are good resources to go to and make those good decisions. I think also we do better with some face-to-face interaction. So reaching out to a athlete trainer in your community. We are a collaboration of about 400 athlete trainers in the state of Mississippi that practice, and reaching out to a high school or reaching out to the colleges, they can find you an athlete trainer that can sit down and really we are advocates for a healthy participation in sports. So I think if you can reach out to one of the athletic trainers, they can really shed some light on what to look for and what steps can be made to prevent these issues.
All good stuff. I appreciate you ladies' time, and thank you.
Thank you.
Thank you.
All righty, you guys stick with us. We got more good for you coming.